Hi, this is Tess from Friends of Flow. I'm here with Frankie Kuehnle. We're talking about the difference between sex, gender, sexuality.
Yes. So I think it's really important to point out that this is something that's been evolving and changing over time. So if you watch this video in 10 years, it'll be out of date. And the definitions will probably have changed. The difference between sex and gender is something we've come to understand a lot better in the last few years. So when we're talking about sex, we're talking about biology. So chromosomes and their functions, genitalia, and if need, more genetic testing if it's not clear. Generally, people fall into three categories: male, female, or intersex. If you are unfamiliar with the term intersex, the older term for it was hermaphrodite. I strongly encourage you to not use that. That's considered pretty offensive nowadays. So when we're referring to sex, we're talking about male. We use the terms male and female, or intersex. Gender has nothing to do with anatomy or biology, but a person's identity. So there's really, they don't determine each other. What someone's genitals look like don't tell us what their gender identity is. The only way you can know somebody's gender identity is if they just tell you it. Then we get to sexuality, which is how you feel about other people. So sexuality is, I am attracted sexually or romantically to women or men or trans people or non-binary people, or the spectrum is endless. So they can relate to each other, but they don't cause each other. Just because you know someone's sexuality doesn't mean we know their gender or their sex. Just because we know their sex doesn't mean we know their gender or sexuality. Those things are all separate from each other.
It's so confusing these days.
It's always been confusing.
Yes.
It's just that we're starting to understand it better. I think that a lot of the comments I hear is like, oh, well, it used to be simpler. Not particularly.
Okay.
It's just that a lot of the feelings people had and the way people had, we really didn't have modern terms for them.
Right.
There are current and historical examples of third genders and cultures throughout human history.
Right.
We've got travesti, which is Central American, mahu's Hawaiian, two-spirit is an indigenous term. There are examples of multiple genders and cultures throughout human history. And because that history isn't taught and has been erased, a lot of people just think, oh, the kids today are making up terms because they want to be unique. And it's much more complex than that. But it is confusing.
What isn't? It'd be just simpler if we all just looked like this and did this.
Yeah, but that would be so boring.
It is boring. It totally is boring.
Wouldn't it be boring if we all looked the same and acted the same?
I think so too.
Statistically, a small percentage of the population is transgender and gender nonconforming. But there are whole groups that are a small percentage of the population that we make minor accommodations to because it makes their lives, which are already made more difficult, a little easier. And so when we talk, there's often, a lot of frustration expressed over, there's only a few transgender patients, why do I have to do this? But it's a small, kind thing to provide the better care. Mm-hmm.
We have a professional responsibility to be concerned and curious about the person's lived experience in health. And so then I want to ask you, what is our role as a nurse to understanding sex, sexuality, and gender?
Well, the first thing I always tell people is, it's not your job to memorize every term ever, because that's not, one, possible. I don't know them all, and this is kind of what I do. It's a changing and evolving thing because humans are always changing and language is always changing. So you don't have to have every term memorized. You should know the basics, and you should know that sex, gender, and sexuality are different, and you should be willing to educate yourself a little bit, and also willing to be corrected. So, even just approaching an interaction with a patient, being conscious. An example I always give is, instead of asking a woman who's wearing a wedding ring what her husband's name is, ask that person what their spouse's name is. And so because if you say husband, unintentionally you're implying that it should be a husband and you'd prefer it to be a husband, which makes the patient less likely to talk to you, which is where we get statistics of about a third of people who identify as lesbians don't get cancer screenings. So all of this just comes back to helping the patient be more comfortable and provide better care.
I sometimes use who's your special someone? Or do you have a special someone? That's my effort to not be to be more
I
inclusive
just
about
asked for
that.
partner,
Yeah,
spouse,
house, your significant other.
buddy. Like,
Yeah,
whoever. I think that most, even if you're not, and that's the thing about wording, you don't have to use perfect words. It's the intention behind them, right? If you're communicating clearly that you care about the person, you're trying to be kind, you'll make mistakes and flubs, but it goes such more smoother. And one of the statistics that, and I'm not like, there's so many out there, but one of the ones that I think is really important, especially for nurses to know, is that 23% of trans patients admit at some point to not coming and seeking health care because they're afraid of us. They're afraid that they will be abused or hurt. So a quarter of this population is concerned for their safety with nurses. And part of that means that we have to step forward and go out of our way to communicate support, because otherwise they're not going to come and get care.